Hi, and welcome back. I'm Filip Lundstedt, your insurance guru, and the reason I'm known as the insurance guru is because I'm going to show you the strategies and the secrets the insurance companies, they don't want you to know. I want to thank you so much for tuning in to our next video where we're going to be covering HMOs versus PPOs and really clearing up a lot of the misconceptions and a lot of the confusion that circles around these programs, and explain it in a way that'll make it easy for you to see whether or not this is a strategy that you want to consider. Of course, we always suggest that you have a one-on-one with one of our top brokers. That way they can get your information, your specifics, your wants, your needs, your values, your fears, all of it, so we can figure out exactly what strategies we should be showing you. And we always show you more than one strategy because we believe that it's your choice, not ours. We just help guide you when you need it the most. So let's go ahead and get into HMOs. HMOs are health maintenance organizations. And what is a health maintenance organization? It's important to understand that there are key features that exist to an HMO. Some of those key features are you are required to choose a primary care physician at the time of enrollment. So you can't enroll into the program and say, I'll pick one later. No, we need it at the time when we submit the application for enrollment. So you must choose a primary care physician, and that primary care physician must come from the network that's associated to that insurance company and insurance program. The second feature that you really want to pay attention to is referrals are needed for specialists. You must get a referral if you want to see a specialist. Now let's take a little side note right here, because I hear so many times from people that they're like, well, I don't really like referrals. Referrals aren't for me. And I like to break down referral because many people will paint referral as a negative thing. And I don't necessarily think that it's a negative thing to have a referral. It depends on your perspective. Now, if you have a doctor that you know, like, and trust, and you really like this doctor, and this doctor makes sense, and you love him, and he tells you, your primary, says, hey, listen, Charlie, something going on with your heart, it doesn't look good, you should definitely see a cardiologist. I seriously doubt that your first reaction is, thanks so much, doctor, I'm gonna go home, get on Google, subscribe to some magazines, do all my research, and find a cardiologist that I think is best, and then I'm gonna go see him. If you were to do that, how long would it take? And what if your situation was dire? More than likely, what you're gonna do is you're gonna look at that doctor and say, Doc, that's terrible news. What do you think I should do? And if that doctor were to say to you, well, I think you should go see my buddy, Dr. Smith, let me let you know if you want to see him and I'll get you all set up. What's that called? That's called a referral. So sometimes referral is advice. It depends on the primary care that you see. So something very important that you want to consider when getting on an HMO is what is your current relationship with your primary care? If you trust your primary care and he takes HMOs, this could be an amazing system for you because you're already more than likely getting referrals from that doctor. Regardless if you're on PPO or HMO, that doctor is referring you to other doctors or giving you advice on who you should see when something happens. So referrals aren't necessarily a good thing or a bad thing. It just depends on your situation and depends on your perspective. Now, something else that we need to know about HMOs is there is no coverage for out-of-network care, okay? So if you wanted to see a doctor that is not in the network of the HMO, you're on your own 100%. You got to pay that whole bill. Now, what it will do is cover you for emergency rooms and urgently needed care or urgent care centers or doctor walk-in clinics or a doc in a box. If you needed to see a doctor and you went to an urgent care center in the middle of Idaho and you had an HMO, you can do that and it would be considered in-network. If you were in California and you had emergency and you had to have emergency surgery and they don't accept your insurance, it's covered as in-network. There are laws in place, statutes in place that protect you from these dangers, especially on Medicare. So if you're on an HMO, you need to know that you can travel on these programs. And that's something I really like to touch on, guys, because here's the thing. Many people will tell me, well, the reason I want a PPO or the reason I'm on a Medicare supplement is because I want to be able to travel around the country and get care if I need it just in case. And I'll say, okay, what do you mean by just in case? Is just in case meaning that you're going to go on vacation to Colorado and schedule a colonoscopy or schedule a stress test or an EKG? The answer is always, well, no, I would never do that. I just want it in case I'm in an accident or something bad happens to me. I said, okay, where would you go if something like that were to happen to you? Most people tell me, well, I'm probably going to the emergency room. I said, well, great. Well, it doesn't matter whether you're on PPO, supplement, or an HMO, because you're covered no matter what at any emergency room if anything happens to you. And that's the beauty of these programs. And there's where a lot of confusion lies, is that people will try to sell you against one or the other. I'm not here to sell you against anything. I'm here to educate you on all the intricacies that exist so we can make the path more clear for you when you're making that decision. Again, we like to meet with you one-on-one, ask you questions, your wants, your needs, your values, and your fears, so we can tailor programs so you can see exactly what strategies exist and what opportunities you have available. Something important to understand about HMOs, which is why they're very popular, is they typically have lower premiums and lower max out-of-pockets compared to other programs like PPOs or fee-for-service programs. Super important that you understand that even depending on your area is going to depend on that premium. I'm going to clue you into something that's a little crazy. Some of these HMOs will actually give you money back. They will literally give you up to $174 refunded into your Social Security to help cover the cost of Medicare Part B. That's right, you heard me correctly. Some of these HMOs are literally paying you to be on the program. And if you have certain conditions like chronic special needs, whether you're diabetic, have a heart issue, or pulmonary function, which is a lung function, you can even get gift cards to grocery stores like Publix or Winn-Dixie or Walmart. Well, they'll actually give you $80, $100, $50 every single month to go to a grocery store and buy groceries, and they'll give you the money back. Some of these programs even give you money to go play golf, give you $500 a year to go play golf games. They give you free gym memberships. They give you over-the-counters. Some of these companies are giving you $100 a month in over-the-counter, which is your toothpaste, Band-Aids, Advil, aspirins, rubbing alcohol, Q-tips, all those different little things that you're spending money on every single month. So again, depending on your situation, depending on where you are in your life, what season you're in, some of these HMO programs can be great. And there's a lot of different HMO programs, and it does get confusing. There's things called DSNPs, which are dual special needs programs, which are for people that have both Medicare and Medicaid. Medicare is federal, Medicaid is issued through the state, and it's for people with lower income or lower assets. Another one, which I just covered, is a CSNP, a CSNP, a chronic special needs program. This is for people that have chronic diseases like diabetes or heart disease or high blood pressure and cholesterol. They're on blood thinners, or they are on pulmonary function like asthma, COPD, or emphysema. There's another one called an ISNP, an institutional special needs program, and this is for people that are staying in institutions like ALFs, assisted living facilities. There are special programs for people in nursing homes. So there's all these different HMOs that exist. And another HMO that you can end up getting on is called an HMO POS. What's POS mean? POS means point of service. And on HMO point of service programs, essentially, just to keep it simple, they are HMOs that you do not need referrals for, which means that you can go see doctors as you please and you don't need permission from your primary. For many clients, this is a perfect bridge for them to get on a product where they have low costs, but they also have control and freedom over who they want to see and when they want to see them. So just to recap, HMOs, Health Maintenance Organization, is where you're choosing a primary care that's in network, and that primary care is now in charge of you. He's in charge of giving you referrals. He's in charge of sending you places and giving you authorizations and treating you. Really what he's known as the gatekeeper. He's gatekeeping. He is making sure that the money is spent properly. And you may say to me, Filip, how is this possible? How can Medicare Advantage programs like HMOs give me money back? How is this even remotely possible? It's really easy, guys. What happens is there's a shift of responsibility that happens with the government. The government, or Medicare, looks at this and says, well, what if we paid private insurance companies money every single month, and for that money, they would take care of the clients, we wouldn't. So when you're on a Medicare Advantage, whether it's HMO or PPO, you got to understand that Medicare's not paying any of your bills. It's been forwarded to the insurance company. The insurance company is in charge 100% of your health care. So with that being said, and I'll give you a scenario, on average in the state of Florida, it's about $1,000 is what the insurance companies are making off of the government. $1,000 every single month. PM. Quick tip. PM, industry term, means per member per month. The insurance companies are collecting a dollar amount per member per month every single month. from that money, they can only keep 18% as profit, which means they have to spend the other 82% on you. That's how you get money back, and low copays and free dental and hearing aids and vision and gym memberships and food cards and over-the-counters. It all comes from those dollars that they must spend on you. And if they don't spend it on you and they keep too much in profit, they are going to get issued problems from the government. The government is going to do audits and going to say, hey, listen, you owe us hundreds of millions of dollars because you did not spend enough on your clients. You did not spend enough of these dollars we've been giving you, so now you owe us that money back. This happens often to insurance companies. They don't want you to know this. They don't want you to do some digging and see this stuff because it looks like a bad thing, but it's not. Sometimes people don't handle their budgets so good and they make mistakes. Sometimes it's done on purpose, guys. No matter what, keep in mind that I'm a broker. I work for you. I don't work for the insurance company. My number one value is to make sure that my clients and potential clients know exactly what's going on and they have the protections that they need based on their wants, their needs, their hopes, and their fears. That's what I care about most. That's how I impact people. So when Medicare Advantage is collecting all this money and they have to separate it out, they choose what kind of contracts they want to do. And we just talked about HMOs. HMOs are a very specific kind of contract. They are called a capitated risk of participation or participation of risk contract. And what that means is that the doctor is saying, hey, listen, I'll participate in the risk of this client. So now you can forward that money to me. So the insurance company says, great, the government gave us money to take care of clients and members and patients. We're gonna pay the doctor, and now the doctor is responsible for paying for your health care. So when you get a referral and you have to go to that doctor, guess who pays for it? The doctor pays for it, not the insurance company. You need a surgery or go to the emergency room or have a big issue, the doctor has to pay for it. So on HMOs, you gotta be careful because certain HMOs will treat their clients one way and other HMOs will treat their clients another way. A perfect way of knowing this is, are you going with an HMO that's a pill mill? Are they just having you in for 5 minutes and all you see is a nurse practitioner and you haven't seen the primary care doctor in 13 months and they're just prescribing you drugs and you're in and out like a cow at a farm? So you got to be careful with those because those are the ones that are collecting dollars. They're issuing you meds or a care plan. And from that care plan, they just send you out and show those numbers to the insurance company. And it shows them that, hey, they're doing their job. Well, really, they're not. They're hiring a nurse practitioner or a PA, and that PA is taking care of you. You're not seeing the doctor. And it may be because they have a high panel. And panel is the amount of patients per doctor. And if they have a high panel, well, they can't see you because they got too many patients. So they hire nurse practitioners in order to fill that void. Now, there are other HMOs where the doctors have low panels. So you're seeing the doctor 25, 30 minutes every time you go, and it's the actual MD. This allows you to build a relationship with your primary care. And on an HMO, that is imperative. You need to have a relationship with your primary because your primary is in charge of everything. Or the approvals, the denials, the referrals, the everything. He's in charge of all the money that's coming in to take care of you. So on an HMO, it's super important that we do the research, we set the expectation, and we put you on a program that makes the most sense to you. So that's how these HMOs are operating. I'm super excited to talk about HMOs because I have a lot of people on HMOs, got a lot of people on PPOs, and we have quite a few people on supplements, and everybody's got a different want and a different need. So we now know how HMOs work and how that could be a great strategy for you for keeping costs low, getting those extra benefits. Maybe you're super healthy and you only see the doctor once a year. The HMO could be a phenomenal program for you. The second thing that we want to talk about is PPOs, Preferred Provider Organizations. Preferred Provider Organizations, or PPOs, have certain key features. The first key feature is you do not need a referral. There's no referral required from the primary care in order for you to see doctors. You can just go and see whatever doctors you want and circumvent the primary care altogether. Some of those other key features are you have coverage available for both in-network and out-of-network providers. And let's break this down simple. In-network providers are doctors that accept your insurance. Out-of-network providers are doctors that do not accept your insurance. There are two kinds of doctors in the Medicare world: the ones that accept your insurance and the ones that don't accept your insurance. If you're on a PPO, you can see both of those doctors, the ones in the network that accept your insurance and the ones that don't accept your insurance, which means you can see any doctor that you want within the Medicare world because they're either in network or they're out of network. There's no kind of network. There's either in network or out of network. This is very black and white, folks. There is no delineation from here. It's very black and white, which means on a PPO, technically, you can see any doctor you want. Now, you will have some higher costs when you go outside of the network, and obviously have lower costs when you're inside of the network. Now, the costs are typically a little bit higher when you're talking about a PPO program. Your co-pays are going to be higher. The premiums many times are $0, and there's even PPO companies out there that give you money back on their PPOs. Yes, you heard me right. PPOs that are giving you refunds in your Social Security up to $174 a month. That's a surplus of $174 a month coming into your pocket to be on a PPO. And keep in mind, a PPO is going to give you a lot more flexibility and freedom to choose your providers and navigate the way that you want. So there's not necessarily higher premiums, but there may be more expensive co-payments or co-insurances, and your max out of pocket may be higher. There are some HMOs where the max out of pocket is $1,900, where when you're looking at PPOs, maybe the lowest one you're going to find is $4,700. So really depending on where you're at, and again, we love to have that personalized meeting with you so we can hand tailor strategies for you based on your wants, your needs, your loves, your values, and your fears, right? But on a PPO, you will have a larger network. You're going to have that freedom to see specialists directly. You don't have to get a referral, which gives you a ton of flexibility, even though some of your costs may be higher. But until we have that conversation and get to know you a little bit, we don't know the reality on what you're willing to spend or what your expectations are for your healthcare. So something that's key to remember about PPOs is that the contract that the PPO has is called a fee-for-service contract. And a fee-for-service contract means the doctor receives a fee for every service he does. So if you go to the doctor and he does a blood test, he gets paid for it. If you go to the doctor and he does a diagnostic, he gets paid for it. He sends a bill to the insurance company then sends him money, and you pay that doctor a copay. That's how fee-for-service works. There's only two contracts in Medicare, and those two contracts are either risk participation capitated contract, which is HMO, or it's a fee-for-service contract. Now, this can get confusing because some of these HMOs are actually fee-for-service contracts. It depends on the carrier. That's why some carriers, they don't give you money back and they're a little bit more expensive, and some carriers do give you money back and they're way less expensive. It depends on the contracts that they're setting up with the doctors. Every company, every program, every county is going to have some differentials here that are important for you to understand before you choose a strategy or make a decision on ruling out one of them. Really, really important that you meet with us. Click a link below and make sure that you set an appointment to meet with one of our brokers where we're going to take your information and really tailor these strategies to you. So something that I want to talk about really quick as well before we wrap up is enrollment periods. Filip, when can I enroll in these Medicare Advantage programs? There's a few different times. It really depends on your situation. If you're turning 65, you what's called an initial enrollment period. And the initial enrollment period is 3 months before your birthday, the month of your 65th birthday, and 3 months after that 65th birthday, which is a total of 7 months that you can enroll in one of these programs. Outside of that, you have annual enrollment period, or AEP. Many people know this one. That's between October 15th and December 7th. And that is your one time during the year that everybody has the ability, whether you're Medicare Supplement, Original Medicare, VA, or Medicare Advantage, or just turning 65 during that time, that you have an opportunity to pick a Medicare Advantage program. If you're currently on a Medicare Advantage program, you also have something called the OEP, or the Open Enrollment Period. And the open enrollment period is from January 1st all the way up to March 31st. And this is where you have an opportunity to change your program. So if you started a program that you picked an annual enrollment period, AEP, and it starts January 1, you try it out for month 1, and then in month 2, you're like, I don't really like this, and it's February 20th, you're able to change that program for a March 1st effective date. So you do have opportunities to change programs as you please. And there are no medical questions. You could have a diagnosis of cancer and be able to switch to a PPO because maybe there's a better facility that you want to see that's not on your HMO. This is possible. People will tell you it's not possible. They are misleading you. I'm telling you things that they don't want me to tell you. You have the ability to change your program in that time of open enrollment period to a different program that might suit you better depending on a diagnosis that you get. Key thing, pro tip I want to tell you, no matter who you do business with, if you have a change in your health, you need to contact your broker immediately. Don't call your neighbor, don't call your friends, don't call a doctor. Call your broker immediately, because the broker will be able to let you know what programs are going to be best for you moving forward. Every program has a rhyme and reason and the right fit and strategy. We want to make sure here at ProCare that you are constantly on a strategy that allows you to win in the game of insurance. There's also another period called the disenrollment period, where you can disenroll from a Medicare Advantage and go back onto original Medicare. And this happens between January and February every single year, January 1st to February 15th, where you can disenroll from a Medicare Advantage and go back to original Medicare. This is very far and few between that this happens, because we always have like Plan B and Plan C strategies for you that we can rely on that give you good health care where you're not going to be subject to that 20% gap. And the last strategy that I want to talk to you about is called the special enrollment period. The special enrollment period, or SEP, is a time of year where you're able to change your program outside of the open enrollment and annual enrollment period. That's right. So April, May, June, July, September, August, right? You can change your program during what people would call the lockout, because you're not truly locked out. Because depending on where you live, maybe there's blizzards or floods or landslides or earthquakes, or maybe there's a pandemic like COVID, or maybe there's a war like the Ukrainian war or the Israeli-Hamas war, or maybe there's hurricanes or flash floods or chemical spills. Those all cause certain things to happen where your state can issue what's called an SEP, and you have the availability to change your insurance again. We use this as a strategy to help you win in the game of insurance. So this way you've got more freedom to jump in between programs. So this is a great thing that we've utilized for years to help people move to a different program in the middle of the year with a bad diagnosis, because they needed the extra care that they needed from one program they weren't getting on another, and we were able to do this because of special enrollment periods. So we never say no, we just need to know more. So you always want to be able to reach out to a broker whenever you have a change in your health, because there may be a better program out there for you. So just to do a quick recap, HMOs are health maintenance organizations. They have networks that you must stay in, you must get referrals, you must choose a primary care at the time of enrollment that's in the network, and for that, you're gonna get lower costs, lower max out-of-pockets, and the potential of getting excess dollars into your Social Security every single month. On the other hand, we have PPOs, and PPOs, preferred provider organizations, are programs that are gonna give you flexibility, freedom, and choice within larger networks that you can go in and out of as you please, and you are not going to be required to have any referrals. But your costs will be a little bit higher. You may not get money back on certain ones, you may get money back on certain ones, but your co-payments, your hospital stays are all going to be a little bit higher. It really depends on what your exact needs are, which we will hand tailor and find out what programs work best for you. Make sure that you click that link below and let us know how we can best serve you.